Dr. Richard Isaacson, we're talking about Alzheimer's disease, and you've mentioned before, and I think many people know, the earlier you can recognize it, the better off you'll be. We both have a history of it in our family, and I've always wanted to say if I could just be in her head for half a day to see what it's like. If I have these issues, do I necessarily know them early enough? And if that's not the case, how much do you rely on family and other family members to get that started early?
Right. So oftentimes the patient isn't really aware of a problem. You'll ask the patient, do you have a memory problem? Oh no, everything's fine, everything's okay. So absolutely, I thoroughly rely on family members and caregivers, and in a patient appointment, if you're going to see a specialist about an Alzheimer's or memory evaluation, it's really imperative that the patient go to the clinic with the closest caregiver, relatives, sisters, brothers, husbands, wives, children. The more people, the better to that first and even second and third appointment. It's very important to obtain a comprehensive historical point of view because a lot of times the patient just doesn't really know that there is a problem.
And speaking of getting family involved genetically, has that been proven to be a risk factor?
Right. So there's a variety of genetic types that may increase your risk. However, I don't do genetic testing in my practice because doing a genetic test is not clearly a diagnostic test. It may give you some inclination of risk, but it won't specifically say this person has or doesn't have Alzheimer's. If you have early onset Alzheimer's disease, it's about 6% of all the cases of Alzheimer's. Those are the types of cases where you could do a genetic test, see a specific mutation, and say, this is definitely early onset Alzheimer's. The rest of the cases, and especially later onset Alzheimer's disease, it's just not as clear. There's a variety of genes that have been isolated just this past week. Researchers at the University of Miami, as well as all throughout the world, got together in one of the largest studies of its type and found 5 new Alzheimer's genes. ApoE, or ApoE4, is really the biggest risk factor for late onset Alzheimer's disease that we're all aware of. I don't necessarily check for genetic abnormalities in my patients, but what we've learned just recently is that we can do a genetic test, and if you're, for example, ApoE4 genotype, positive or negative, you may actually respond better or worse to a variety of treatments. So currently in 2011 we know of at least 5 interventions for Alzheimer's disease treatment that actually will respond better if you're negative for this ApoE4 genotype. So there's still a lot more to learn with Alzheimer's genetics, but I don't think we're there yet in terms of widespread testing, in terms of making a diagnosis.
Can you talk about other risk factors for someone that's in their 30s, 40s, even 50s that they can tell themselves, okay, I need to be careful because I have X, Y, and Z type of risk factors?
Absolutely. Well, living a good, healthy lifestyle is important. If you have metabolic syndrome, which is abdominal obesity and high blood pressure, other things like high cholesterol, diabetes, these are all things that will definitely attenuate the progression. Speed up the progression of Alzheimer's disease, or make the onset earlier. So if someone can live a better, healthier life, follow a 20-step plan, they can really make significant changes in their potential for the onset of Alzheimer's disease. Smoking, for example, exercise is extremely important. We've been able to prove in mice that if mice exercise, mice that have Alzheimer's disease, if they exercise, they can cut the amyloid protein in the brain, or the pathologic protein in Alzheimer's, they can cut that amount of protein in the brain by up to half. So exercise is something that is really important. If you live a very sedentary life, get up off the couch, stop just watching TV and get out there. 4 to 5 times a week, 30 to 45 minutes of exercise as approved by a physician, very important. Someone in their 30s and 40s should see their primary care doctor. Get a qualified medical professional to give you advice on healthy things that you can do. Extremely important. Honestly, there's just so much we can do, but it really takes the supervision of a qualified medical professional, and it takes motivation on the part of the patient and the family member.